you.
Rector, members of the committee, colleagues, family, and friends, good afternoon. There is nothing new except what has been forgotten. This is a tale of what was forgotten and was found anew. I'm presenting my thesis, Yaws in the Philippines, the rediscovery of a forgotten and neglected tropical disease. I will describe what Yaws is, discuss the status of Yaws in the Philippines, the lessons learned, and the way forward. Yaws is a tropical, highly infectious, chronic disease of the skin, bones, and cartilage that mainly affect children in remote and impoverished villages. Skin lesions may be itchy, and foul-smelling and bone pains can occur. It is passed on through skin contact and is not sexually transmitted. Poor environmental and personal hygiene promote its spread. Yaws is caused by a bacteria called Treponema pallidum perteniu, which is closely related to the cause of syphilis. Yaws is a skin-neglected tropical disease that has been earmarked for eradication by the World Health Organization since 2012. Yaws can be quickly cleared using 1 dose of oral azithromycin, as seen in this child we treated, but reinfection may occur. The eradication strategy therefore entails the treatment of the whole community, followed by monitoring and additional rounds of treatment as necessary. As with syphilis, Yaws has 3 stages: primary or mother yaw, a single lesion often acquired during childhood. After a few weeks or months, the secondary stage occurs with numerous daughter yaws. These are the infectious stages. Skin lesions can heal spontaneously and become latent yaws. It also occurs in between flares of secondary yaws lesions, and there are no active skin or bone signs. Adults may have latent yaws throughout their lives. The tertiary or late stage of yaws is considered a non-infectious state. Now, why is yaws important to find and treat early? If left untreated, around 10% of yaws patients may develop a tertiary yaws, which causes skin ulcers or permanent bone and cartilage deformities. It is estimated that for every yaws patient in the infective stage of the disease, there are 10 other patients with active disease and 30 others with latent infection. How is yaws diagnosed? We should at least have the typical skin signs and blood tests. Yaws has pink, bumpy appearance like raspberries or a moist yellow mushroom look. There should be a combination of the skin signs on a person who lives in an area where yaws is known to exist and has low risk factors for having syphilis. Blood tests are needed to detect treponemal and non-treponemal antibodies. If both treponemal and non-treponemal antibodies are detected, the person has either active or latent yaws. How widespread is yaws in the world? As of 2021, there are 15 countries that are known to have yaws. The Philippines is the 14th country to be declared endemic for yaws in 2017. Since then, Liberia became the 15th country. But in 2021, Malaysia reported a confirmed yaws case. India is the only country that was certified as free of transmission in 2016. There have been over 100,000 suspected yaws cases reported by 13 countries. However, the status of yaws in at least 76 previously endemic countries remains unknown. Yaws was widespread in the whole Philippines during the Spanish and American colonial times into the 1900s. Yaws was a public health problem in the whole Philippines and in several tropical countries in the 1900s. So the World Health Organization and UNICEF funded a worldwide eradication campaign using injectable penicillin for treatment. In the Philippines, the trichomatosis control program ran from 1950 to 1964. The number of cases dropped from 8.2% to 0.4% by 1960. Yaws was generally thought to have been eradicated, but some cases remained, spreading yaws again. Interest and funding declined. After 1973, Yaws ceased to be a notifiable disease in the Philippines and was forgotten. How did I find Yaws in the Philippines? I found Yaws completely by chance. In the year 2000, when I conducted community skin surveys in villages that were known to have leprosy in the southern Philippines. On my first day, the local health workers asked me, "Have you ever seen Yaws? We have a lot of cases here." As a dermatologist, I was both surprised and excited to have found a disease that was thought to have been eradicated. I reported the presence of several Yaws suspects to the Department of Health, but there was no program for it at that time. Then in 2012, the WHO earmarked Yaws for eradication. Countries that had Yaws but stopped reporting were encouraged to find out if Yaws was still present. Fortunately, in 2013, 13 years after I first encountered Yaws, the Philippine Department of Health commissioned me to confirm if Yaws was present in the Philippines. The first study surveyed 9 randomly selected public schools in 3 provinces where Yaws suspects had been previously cited in Liguasan Marsh, Mindanao. The second study looked for Yaws cases in 5 selected remote villages and those with indigenous peoples in the Luzon and Visayas island groups. My thesis is based on these 2 Yaws studies. My research questions were: are there still Yaws cases in the Philippines, and in which areas is it present? What does Yaws look like among Filipinos, and what should be considered when testing for Yaws? What are the personal, social, and economic effects of Yaws on affected Filipinos? Is there a need to establish Yaws control or eradication programs given the status of infection in the Philippines? In order to find this forgotten disease, I tried to crowdsource for any information on Yaws from dermatologists, other physicians, and health centers. Using electronic means, I showed them images of Yaws and asked, "Have you ever seen Yaws?" I focused my search for Yaws in remote and impoverished villages and among indigenous peoples. We conducted community screening for any skin problems, especially among children, and did blood tests on Yaws suspects. Those with confirmed Yaws, the household members and health workers, were interviewed about the effects of Yaws on their lives. All patients were treated for skin diseases, and all Yaws cases and close contacts were treated with 1 dose of oral azithromycin. Are there still Yaws cases in the Philippines, and in which areas is it present? A total of 3,018 children and adults from 14 study sites were examined for any skin disease during the 2 Yaws studies conducted in 2017 and in 2020. In the first Yaws study, active Yaws was confirmed in 4 children and in 5 out of the 9 study sites. In the second Yaws study, active Yaws was confirmed in 4 children and 1 adult. They were all found in 1 village of indigenous people in Luzon Island Group. A total of 33 Filipinos affected by Yaws were detected. 9 active, 10 latent, 14 past Yaws, and 1 child with Yaws bony deformities. There were no tertiary or late cases found. The Yaws cases were found in Luzon and Mindanao island groups with a spotty distribution. Despite the limited study sites, we were still able to find Yaws. Yaws seems relatively rare, but this is an underestimation because it has been forgotten, not recognized anymore, and not part of the disease reporting system in the Philippines. When I crowdsourced information on Yaws and requested health personnel to report Yaws suspects to me, I found that Yaws had indeed been forgotten. Only 3 dermatologists had ever seen Yaws in the past. Our physicians could not recognize it, and majority had no information about Yaws. What does Yaws look like among Filipinos, and what should be considered when testing for Yaws? Yaws has different appearances. This is our first confirmed case of active Yaws in 2017, a florid case of moist cauliflower and raspberry-like tumors on his armpit. Another boy had a moist cauliflower-looking yaw above his lip. Yaws can also appear as dry bumps and wounds, especially on the arms and legs. Other children had dry, whitish bumps and patches. Yaws also affects the soles of the feet, creating painful wounds. We found the first case of Yaws bony deformity in an 8-year-old Aita from Luzon. He had active Yaws skin lesions and bowing of both forearms that developed over the past few months. When testing for Yaws, rapid tests that only require finger prick blood are practical and useful. One must remember that the blood of Yaws patients reacts similarly to blood from syphilis patients. Among older teenagers and adults, syphilis may be possible. This is why children are the focus of Yaws screening and confirmation. Polymerase chain reaction, or PCR, can distinguish between syphilis and Yaws bacteria, but this is not readily available. What are the personal, social, and economic effects of Yaws on affected Filipinos? I found another dimension to the problem of Yaws in the Philippines. Yaws is not only a physical problem. It does not only affect children, but all stages of life. It has lifelong socio-economic consequences. Among children, Yaws is mainly a physical problem, but can lead to teasing due to its unpleasant appearance. Among adults in Mindanao, Yaws was considered a stigmatizing disease due to the persistent positive treponemal blood tests associated with syphilis and promiscuity. This has led to a loss of work opportunities due to rejection from overseas employment. Is there a need to establish Yaws control or eradication programs, given the status of the infection in the Philippines? There is a need to establish a Yaws eradication program in the communities where Yaws has been confirmed. If Yaws is for eradication, even one active Yaws case is significant. It means there are hidden cases in the same village. It takes only one infectious person to spread disease rapidly. The number of Yaws cases in the Philippines may appear low, but this is likely due to the underreporting of this unrecognized disease. We should act now, while there appear to be a few affected communities. So what are the next steps? Due to the evidence from the Yaws studies, Yaws is now one of the priority multiple diseases for elimination in the Philippines by 2030. For the villages already known to have active Yaws, there are ongoing eradication programs, continued case detection, and community treatments. Water, sanitation, and hygiene are essential for Yaws eradication. For the whole country, Yaws should be a notifiable disease once more, and active surveillance will be established again. We have to increase public awareness, training of health personnel, and have the necessary blood tests and medicine. A community skin health approach is needed to detect more cases. I hope that other countries previously endemic for Yaws will learn from the Philippine experience. The rediscovery of Yaws to health policy and program was 23 years in the making. What a journey it has been. Thank you for your attention.
Thank you for your presentation.